Hey everyone, it's Dr. Steve again from Elevate Sport and Spine, and I wanted to make a video today to talk to you about range of motion. First, we need to discuss what it is, and it's pretty simple. It's just what available motion there is in our joints that is measured in degrees, and there's a standard that we measure against for each of our joints that have been derived biomechanically. We're going to use an example of hip flexion here, which ideal hip flexion is about 90 degrees. So you can look up all the different stuff for each individual joint, but we're just going to kind of focus on this today. There are two different types of range of motion that we need to think about, and one of them is called passive range of motion, which is how much motion there is available to the joint when either you're moving it passively or having someone move it for you passively. So either, in this case, pulling on your leg with a towel or a band, or having someone else push your leg up into flexion would be an example of both passive range of motion. Active range of motion, on the other hand, is how much control we have over that full range of motion when we're just asked to actively use our muscles to pull into hip flexion in our case here. So that kind of covers what it is. Why is range of motion important, and why should we aim to have good range of motion? That's pretty simple, is that it just gives us movement options. It allows us to be more functional in our day-to-day lives without overloading things one side versus the other. So it helps us with wear and tear, makes us more efficient in our movement so that we can go longer, we can be stronger when we're doing things, and it protects us from injury as well. So after all that, it's how do we kind of improve our range of motion. So we need to talk a little bit about these three scenarios, because the first thing we need to be able to do is kind of classify ourselves in how we need to work on our range of motion. So in this first case here, this guy's doing really well. This is where we kind of want to be. So this is our goal. So we want to have, in this case, 90 degrees of hip flexion. You can see here that there's a little bit of a gap that exists between these two things, and that's just because most of the time people are not going to have 100% control, passive versus active range of motion. So the best you can do is aim to be kind of within a good amount there. So this is where we want to kind of be. The second case here, we can see that this guy has pretty good passive range of motion. So if he's pulling on it, or if someone else is pushing on it, he can get to that 90 degrees. But when you ask them to lift their leg as high as they can, then he cannot get it all the way up there. So there's this zone that exists kind of in between here, which is kind of important to think about as far as some of the stuff we mentioned earlier, which is that prevention of injury. If we don't have good control of this kind of danger zone in here, that's one of those areas where if a person kind of passively gets into that position, they're going to have trouble controlling that range of motion. They're going to risk kind of loading themselves up more so than their tissues are ready for, and that's typically when they're going to hurt themselves. So we want to try to give ourselves exercises that help close that gap as much as we possibly can. This can usually be accomplished by doing some simple contractive type exercises where we use our muscles to teach our nervous system that the area in between here is safe. And typically we want to do that by loading it here at end range using some isometric contractions, which is just kind of pressing into something or pulling into something without really moving our leg. So those types of things, it's a technique called CRAC, C-R-A-C, so it's contract, relax, antagonist, contract. So the C-R-A-C, and this antagonist idea is the group of muscles that are on the opposite side of the joint that we're pulling to, which is known as the agonist on this top side. So what we're going to want to start with is an isometric contraction where we're pulling that leg up towards flexion as much as we possibly can and holding it there for a few breaths, which is important as well. Being able to breathe into this range of motion helps us connect to it neurologically. Again, teaches the nervous system that that range of motion is safe, and that we have access to it. So the more that you're able to breathe into these types of positions, the faster this will improve. If you're feeling like you're having to hold your breath or strain against it, your nervous system is sensing that range of motion as a threat. It's going to go into a stress response and prevent you from being able to move in there freely. And as soon as you get done doing exercise, you're going to lose any of the range of motion that you had gained very shortly after. So we want to work in areas where we can breathe appropriately. So this guy will improve mostly with these types of things here, these types of motor control exercises that we have to kind of teach us that this range of motion here is safe. This last guy's got kind of a bit of a road ahead of himself in that he lacks full passive and full active range of motion, so he gets some extra assignments here, and that tends to focus on kind of soft tissue techniques where we're looking to expand the tissue extensibility of everything that's on this posterior chain in here by doing things like foam rolling, or ball rolling, which will help attack all of the superficial kind of soft tissues that are in there, be your fascia or your muscles, your tendons, some ligament and things like that. There are joint mobility exercises which target specifically any of the joints in this system that may be limiting our ability to go into hip flexion, and that can be either done with certain types of exercises using bands or ways to isolate that. We're not really getting into that today. And then the last thing that can sometimes be helpful is nerve flossing techniques, which we're also not getting into, but these are all types of passive types of things that a person that's in these situations may want to consider on working on first. So their mobility sessions would include this as well as the stuff that this person is doing, so that we take advantage of the new range of motion that we've created after we've done all of those things. So some considerations with all of this here is really important when we're thinking about improving our range of motion. We want to make sure primarily, number one, that there is no pain. Okay? It can be a little stretchy, deep, dull, achy stiffness is okay to work into, but if it's painful, you need to stop. You need to get that assessed as to why you're having pain there. Number two is what we mentioned in before, is that we need to be able to breathe. And this one's very important. If you cannot breathe in the range of motion that you're creating from your belly in a nice in a nice sort of relaxed way, again, we're going into that threat response and your body's going to shut everything down and you're not going to be able to get meaningful, long-lasting improvement. So those are the kinds of things that we need to think about when we're improving range of motion, so that we're attacking it in more of a systematic way. You need to think about what sort of priorities we have as far as movement goes, because there can be lots of different places along here where things are restricted, and we want to make sure we're attacking the main ones first. You can get better ideas about that by getting assessed, asking questions about those things, but we want to make sure that we are also, and last thing that we're doing is staying consistent. So if we focus on these sorts of things here, should be able to improve our range of motion. Hip flexion is just one example of this. Like I said, this can be improved all over the place. So if you have specific questions, it's best to go and get assessed, see where you're lacking range of motion, see where we're having situations where we have good passive versus active range of motion, or where we have asymmetries from side to side, so that we know where our priorities should be as far as improving our flexibility, so that we can attack this in a safe way and a strategic way, so that we improve our overall function and things going forward. So I hope that answers some questions about range of motion and things like that for you. If you have any questions specifically for me, feel free to reach out anytime. Otherwise, we'll see you next time. Take it easy. Bye.